They keep changing around. Oh,
All right. So, heartbeats, how are we this beautiful day, beautiful ones? Again, I am Sharon Reed, the Heart Lady, and I have another guest, a special gift. You know, all my guests are special. So, she is a gift. And she is a special, special person. And I've been wanting to interview her for a while and introduce you to her. She is new to Atlanta. So let's give her a good warm yay. She's a peach now. Guess what? She's came from where I migrated from, New York, the Big Apple. That's right. We got the New Yorkers going on. And so, heartbeats, I'd like for you to meet Dr. Akiyaa Azula. Isn't that a beautiful name? Akiyaa Azula. I'm gonna ask her what that means later on. But she has developed this system called creation. And this is just not any system. This system is where it helps to unravel the blocks that you may have that's keeping you from moving forward. That, these things that you keep on doing over and over, and you kind of figure out, why am I doing this? I know better, but it keeps on showing up. Well, she helps to uncover that, unravel that, unpeel that onion so that you understand what it is and that you can move forward. And so I'd like for you to meet Dr. Akiyaa. She is a medical intuitive. Yeah, she'll tell you what that is. And she is an acupuncturist for what? 40 years. 40 years. This is a doctor with a lot of experience and someone that we're going to get into her head and figure out. I want you to know how she can support you. This channel is all about introducing various ways, other modalities on how you can heal yourself naturally and being able to align your body with your mind, spirit, so that you can heal without using Western medication if you don't have to. Nothing, we're not talking bad about the pharmaceuticals. What we are saying is that this is a complement to, and that we are saying that it's part of a lifestyle change that can make you healthier within yourself and doesn't have the side effects that some of the medication does. So, with that being said, because you don't want me to go on my soap opera with that, right, Dr. A? As you'll hear me affectionately call her Dr. A, as some of her other friends do, but we love her name, Akiyaa Azula. So, I'm going to start with that, Dr. A. What does Akiyaa mean?
Akiyaa actually means it's more of an imagery. Um, I have a guide. He's a very tall warrior master.
Mm-hmm.
And here, basically, the image is that I sit on the handle of his sword.
Mm.
And when things need to be battled, whether in life or spiritually or what have you, when there's a battle ensuing, the
Yes.
minute he unseats his sword, I come alive, I fight the battle,
Ooh.
and I go back and sit. Now, what also came to me about the name was this insight that Akiyaa, I remember a Hindu lady said Akiyaa meant like eyes, like sharp eyes.
Yes.
And one of the, I don't know, it's not a totem, but like you have like a spirit animal.
Mm-hmm,
So
mm-hmm.
one of them is the hawk. And the hawk has really good eyesight as far as looking for the prey. So whenever the battle ensues, the reason why I'm sitting on the handle,
Mm-hmm.
I watch and see everything going on, and it's like I need to go right there.
Okay.
And I usually go right there, and it's over with. And that's pretty much how I work with people when I'm healing them. It's
Mm.
always like getting rid of the noise and getting right into that focus and seeing it's right there.
Right.
This is where we really need to go. And so that's how I have developed a system to help people.
People. So
That's what it
Akiyaa,
really
so Akiyaa is the one who has the eyes to see deep within and
Yeah.
be able to use that image, that visionary, and apply that to the body. And as a medical, and so you use your intuition and also your medical background and kind of merge them together. And
Yes.
that helps for you to pinpoint where the ailment is in the individual.
Exactly. Because what I had gotten a reputation, I had a practice in Orlando for about 22 years, roughly around that
Mhm.
span there in that city. And I gained the reputation because of the work that I do, because of the medical intuition work. I could back up and tell you how I came to that, but
Yes,
I
please
got
do.
the reputation that if you could not figure out what was going on with your patient,
Yes.
Akiyaa, and it's because of that keen able to pinpoint what it is that's actually going on with someone. It's
Hmm.
because of that. That's the reason why I got that reputation. If you can't figure it out, send them to Akiyaa. So all the different acupuncturists, chiropractors, medical doctors,
Yes.
like this diagnosis makes no sense. We can't figure out what's wrong with you. And that was my reputation.
20, you must have had a good reputation because 20 some plus years is a lot.
Mhm.
And
Yeah.
shows that you are a professional, shows that you have consistency, persistence, and resilience. And so now you've
And
left Florida and moved here to Atlanta. So you get to share your wonderful gifts, your medical intuitiveness, and the acupuncture with us all. Thank you for
mhm.
that. So tell, how did you get started with acupuncture?
Okay, so I was one of those kids who I guess nowadays you call it gifted, but back
Okay.
then you call it advanced progress
Hmm.
kid and got skipped a grade.
Hmm.
So I graduated high school at 16.
Okay.
Thought I wanted to be a psych major until I got in the lab and I saw all the little rats running in the mazes and
Yes,
no
I
way,
remember that. I
I
started
can't.
there too.
Yeah. So I went from there thinking I wanted to be a psych major to
Uh,
major surfing. So now I'm in my junior year and I've had a major every semester. Um, so I was in my last year of my junior, and one of my professors said to me, she said, "You're the only one that made it an A," because now I'm in the dance department of all places, right?
okay.
So she said, "You're the only one that made an A in a class called kinesiology." And it was studying the movement and
Mhm.
seeing the anatomy and seeing how dancers won't injure themselves if
Yeah,
they move, position their bodies a certain way.
yeah,
And I love that class. And nobody else, because they were all dancers, nobody else liked all that medical anatomy stuff.
yes.
I loved it. And she's
Physiology, yes, yes.
really good
Yeah.
with it. She suggested that maybe I take dance therapy because I knew I didn't want to
Mm.
be a dancer. So, being the nerd, or someone said you're really inquisitive, that I am, I went to the library and I got a book on every single thing that said therapy, art therapy, music therapy, dance therapy, physical therapy.
Wow.
And in the physical therapy book, they mentioned acupuncture. It was just one line that physical therapists were not able to needle because it was invasive in the state of New York. So that was the one line. But when I saw the word acupuncture, you ever had like I think it might have been a spiritual moment
Mm,
where all of a sudden you have like a little light bulb goes off in your
yeah,
head and it was like bing, and I was like, oh, I want to do that.
that's it.
And then the
Yes.
next thought that came was that my mother will not allow me to go to China to study, because that was my thought. I had to go all the way to China.
Yeah, because it
Not
is
going to allow
Eastern philosophy. Yeah, it is a Eastern
me.
medical modality.
So
Hmm.
So I kind of dismissed the thought. And the very next day, back in those days, they used to have food vendors. These guys, I went to City College. So these guys used to have these tables with like nuts and falafel and all kind of stuff. And they would come and they'll sell it to the students between classes while you're walking by. And
Right.
one of the guys had a flyer that said acupuncture on it. And I was like, oh my God, I just read a book and they mentioned acupuncture. I wanted to take it. And it was 3 weeks out. I never forgot, it was a green flyer, looked like it was Christmas. So I'm waiting patiently, like impatiently, I should say, for this 3 weeks to come by to go and meet the acupuncturist. So I go to the event, this open house
Yeah.
for his wellness center, and I'm sitting there, and this is in Harlem.
Yeah.
So everybody looks like us, you know,
Right.
they're Latino or Black, but
Right.
everybody looks like us in
Right.
the venue. And I go in there and I'm waiting for the acupuncturist to come, and they're late. And so my concept of the acupuncturist, I'm thinking like Mr. Miyagi is going to walk into the door. And at the end, these two brothers walk in, and I'm like looking behind them, looking for Mr. Miyagi to come in. And I'm like, oh, the acupuncturist didn't come at all. And the two brothers, they go up front and they start talking about acupuncture, and it blew my mind. I'm like, they're the acupuncturists. So, you know, like I had this concept, you know, stereotypical concept of what the acupuncture should be like or look like. And it turned out to be these two brothers. They actually started back in the 70s, where the drug epidemic in the inner cities was very high. People were drugged out on heroin. And, you know, and the treatment for that was methadone. So they slept all day. They were absolutely useless. They
Right.
wanted to do something for the community. So
Yeah.
they actually went and studied, and they found that China had a similar drug problem, hence the opium wars.
Well, that's right. That's right.
So they wondered, how did China get rid of the drug problem? So how they got rid of the drug problem was, number one, your neighbors ratted you out and you could face the firing squad. So that was the incentive they gave. That
Oh.
was China, communist China.
Mm-hmm.
And if you, because they felt you were useless to their society.
That's right.
So what happened was that they started to apply acupuncture, especially ear acupuncture, to
Yes.
help detox
Curriculum.
drug addicts. So there was a gentleman from Quebec. He was studying in China, and they met him in China, Dr. Matula Shakur, and the name Shakur sounds familiar. He's Tupac's stepdad, which I met Tupac when he was a little kid. And Dr. Richard Delaney. They got licensed through Quebec International Association of Acupuncture, which was interesting because it was a father and son. They were both Romanian, but they studied with a guy that had lived 20 plus years in China, named de Morant, who went to France and taught all the doctors there acupuncture. And then they outlawed it and said he wasn't a doctor. So they banned him from practicing.
Yes.
So they were students of Morant, was like one of the first people that brought acupuncture to the West. So the Wexers are now in Quebec, they meet in China, and then they formed this school in New York to treat people with acupuncture. It was called the Black Acupuncturist Association of North America, which the acronym was just BANA. It looked like banana, but it was actually BANA was the initials. So that's where I went to school.
Wow,
And
that is some interesting history there. And I'm, New York, I had never heard of that. Had I had heard of that, I'm sure I would have been very
would have crossed paths.
inspired by that, for sure, for sure.
Yeah, but it was just that the chance that I read it in the book, the chance of seeing the flyer and then meeting, and the tuition was $450 because I asked them, how much is it to come to your school? And they said $450 for the semester. Went to my bank, took out $450, wrote them a check, and that was all.
And the rest is history, huh?
The rest is history. And what I found when I was doing acupuncture, sometimes people believe in past lives, some people don't believe in past lives. I would describe it, to me, it felt like deja vu, like I've done it before. Like there was this remembering that was happening. I never opened the book and read anything in the book. I would just flip through the book like looking through a magazine and looked at the pictures, but I understood how to do acupuncture, even though I was 19 at the time.
Wow.
And never took biology, never took any health sciences, just a kinesiology class.
Yeah. And could you, for the viewers, because I'm very familiar with what kinesiology is, can you tell viewers what kinesiology is?
Okay, so kinesiology is the study of the human body and movement and the structure of the human body. And so for the dancers, like, a dancer will do like a leap or maybe an arabesque where they'll lift their leg and they may have hip pain or foot pain. So we look at the positioning of their body and describe to them how they had to position themselves. Like I think like people that work in offices, they talk about ergonomics. like how you position your body and how you sit so you don't have pain or
Yeah.
discomfort. So that's what kinesiology is. As a, you know, some people get it mixed up with applied kinesiology, which is more
Yes.
like muscle
Muscle
testing.
testing. Yes.
There's like two different types of kinesiology.
Completely, yes. Yeah, so yeah, I use muscle testing in my practice. So I'm glad for that differentiation there.
Yeah.
Um, so what made you think, how did you know that you were a medical intuitive?
Okay. Another backstory, at the acupuncture college, I met a classmate of mine. She was highly intuitive. She was going through what I guess people would call the call-in, where a lot of people who are highly spiritual, highly gifted, whether they're medically gifted or they're gifted as far as mediumship and all of this, they
Mm.
would go through this phase that almost looked like they're going through some kind of psychosis or madness.
Oh,
So she was a physician assistant student,
yeah, okay.
New York, and her last semester, she had this vision that she saw this vision of all, like all nations in front of her. And she went into what we would call an aesthetic um, reaction, where she started speaking in tongues and she started shaking. And this is in a classroom, this is in a medical classroom.
Wow,
So they sent
okay.
her to Bellevue. And when they sent her to Bellevue, it just so happened that she was assigned to a psychiatrist who
Mm.
had just did her postdoctorate in Africa.
Mm-hmm.
And the lady, when she described what was happening to herself, the doctor said, what you're describing sounds like what happens to the healers in Africa before they become healers. They go through this phase. So all over the world, most healers go through this phase that they call the calling.
Calling, yes.
In medical terms, in Western terms, it might look like they're going through some kind of madness or psychosis.
Mm-hmm, mm-hmm.
So she went and she left the physician assistant and she decided to continue her medical education in acupuncture. And we were classmates and we became friends. So she found out that she had this call in, and the psychiatrist said, well, you know what most people do in Africa, they find a mentor or someone and go through some form of initiation that grounds them and balance them so that they could use these gifts that they have.
Nice.
And she went back to Trinidad. She went through a process they call mourning. This is like the combination, like, you know, in a lot of cultures, there's this combination between like African beliefs and Christian beliefs, and
Please,
there's this
yeah,
merge
yeah,
a lot
right.
of countries throughout the diaspora. So she went there and she got grounded, and I started assisting her. So
Mhm.
whenever she had a call or she had to go, whether it was to do a cleansing on someone's house or do a spiritual treatment on someone, or even she was a very accurate intuitive. So even to do that, I would help her out whenever she had to do this. I would just wind up being her assistant because
Well,
we were friends. I went from friends to being kind of like her assistant in all
distance.
these
Yeah,
situations.
yeah.
So I was exposed to that, but I really thought that, oh, that's something that she could do because, you know, that's her God-given gift.
Gift, yeah.
I and the reason why I didn't see that I could do it, I didn't really want to do it. And the reason is because whenever she helped someone, she would take on their pain.
Pain. Mm-hmm.
So if they had like severe migraines, she would have severe migraines for days. If
Wow.
they had bad stomach, she would get that same symptom. So they'd walk away feeling great, but she would take it on.
Yeah.
So I was like, no, don't want to do that. I'm not into pain. I could pass on that because
Yeah.
I thought that was part of the process.
Yes.
So for a long time, I would deny that I had any intuitive ability. When I fast forward, I went to acupuncture college because I wanted to understand the herbal medicine part of acupuncture. The brothers in New York, their school, we learned acupuncture and we learned how to treat patients with acupuncture. And we knew how to give, you know, like if you had a urinary problem, you know, we gave you Western herbs for it. So juniper berry, uva ursi, things like that. But I really wanted to understand how to put a herbal formula together and understand the wider materia medica and pharmacy that went with acupuncture. So I actually went back to acupuncture college back in the late 90s, early 2000s.
Mhm.
And I studied at the acupuncture college in Florida. That's what brought me to Florida.
Oh, okay.
And um, I loved it. And what I found with while I was at the school and I was an intern, students would always call me in the room when a case wasn't going well. And I would walk in the room and look and say, oh, the needle needs to be in the other direction. Or, okay, the patient needs to take a deep breath. Let me put my hand on this part of their body, take a deep breath. Okay, now you're going to put in this extra needle. So I just somehow knew how to do that without thinking about it. And they would all say to me, Akiyaa, you're so intuitive. Oh my God, you're so intuitive. And I would go, no, I'm not intuitive, because to me, intuitive is
Because of
pain.
that belief that,
Yeah,
yeah,
I'm going to take on someone
yeah,
else's
someone
pain, and
else's energy.
I'm
Yeah,
not signing up for that.
right.
So when I had my own practice in Orlando, a lot of my, not a lot, I'd say 15%, a lot of my patients got well. They healed and responded very well to acupuncture and herbs. But there was, I'd say, at least 15% of them that their symptoms would reoccur, or they'd just like hit a wall and you couldn't get them better past a certain point. So I
Mhm,
started thinking there must be something else, because I consulted with my mentors and my teachers,
mhm,
gave them different formulas, tried everything.
mhm,
Nothing really was working to change it. And I said, it must be some kind of mental, emotional, or spiritual
mhm.
thing going on with them.
Yeah.
So that's when I started using the medical intuition. And how this actually started, I'm working on this patient, and I swear to God, their liver starts talking to me and
Mm,
spilling the tea. So, I'm treating them for, let's say I'm treating them for sciatic pain. And all of a sudden, their liver starts telling me, oh, this is because they have a problem with their sister and
anger.
the other thing is going on. So I'm hearing this narration in my head
Mhm.
about all this stuff. And I was like, should I say this to this person? I hear, yes, tell them. And then when I say it to the patient, they go, oh, that makes so much sense now. And you'll see this relief just wash over them.
Wow.
And from then I started using my medical intuition. Now I would see things, I would hear things when I was working on things. But like I said, I was in denial about having that ability for a very long time because of the whole pain issue. And then when my patients, they started to really like refer more people, like, oh my God, she can find out exactly what's going on with you. She can find out what it is, because the whole thing about it is it's extremely accurate. It's, you could take all the medical tests, you could do all the diagnosis and all of that, which is a good guess.
Mhm.
All the tests, it's ruling out a whole bunch of stuff that's not.
Right.
So with this, you're actually talking to the person, we could say their spirit, their higher self. You're actually getting information directly from the person as to what's happening to them, but it's a part of the person that they're not fully conscious of
Conscious
or
of.
aware of
Yeah.
themselves.
Yeah.
So by tapping into that aspect of the person, you're getting very detailed and accurate information as to what's happening with them.
Yeah.
So
Yeah.
I did that for a number of years. I actually trained a number of students because they want to know, how are you getting these results? And I'm like, well, I do medical intuition. And they started saying, well, because I also taught at the acupuncture college. So I'm responsible for a lot of acupuncturists out here on the market, especially in
Wow.
Florida and
Thank
throughout the
you.
US.
Yes.
Yeah. So they would always ask me, and I would try to explain to them. So then they asked me, could you teach us? So
Mhm.
I started teaching medical intuition, letting them understand how that could be done. And that led me to the development of the system that I use called creation.
Wow. And what
So
made you call it creation?
a meditation that I had one morning, I was told that it was creation back in 2003. And the only reason why I remember uh, the year that I heard it was The Secret came out that year.
Oh.
And so I remember watching The Secret and I said, is that creation? And I heard, no, that's not creation. And then, people were into all this manifesting stuff,
Station. Yes, yes.
manifestation. And I've said, is that creation? And I heard, no, that's not what creation is. So as it went on for a number of years, and let me back up and tell you this piece. The lady that I helped and assisted, one day we were in her home, we were sitting on her living room couch, and she said to me, she said, you will not be doing much acupuncture. She said, you have these big strapping men in your office. There's this long corridor, and all these strapping men are there. They're doing the acupuncture. What you're doing, you're touching people on their heads. And when you touch their head, it looks like they go to sleep, but they're not asleep. They look like they're in a trance, but they're not in a trance. They just feel like they went somewhere, came back very serene and very refreshed. And when she told me I'm touching people on their heads, I'm like, say what? It's almost like, what are you talking about, Will? It's me touching people on their heads. I might have been like 21 or 22 at the time.
Yeah.
I'm like, I'm not touching people on their heads. Only ministers do that nonsense.
Yeah.
Touch
And
people
it's,
on their
yeah.
head.
Yeah.
So I was like, I'm not going to do that. But it always stayed in the back of my mind. So I did a lot of different energetic systems to help my clients heal along
Yeah.
with the intuition.
Yeah.
And, there was a few systems that I did where you either tap people. So I was like, is this touching them on their head? And then sometimes I'm working on someone and I had to touch their head because it said balance their brain. I'll hear, I don't know how to balance their brain or
Yeah.
balance the chakra.
Yeah. So is that like working with the amygdala or the
It's
pineal gland?
it could be, if that's the problem, like that's a very specific thing, the pineal and the amygdala. It could be that, if that's what the issue is with the person.
Because I thought about the balancing and the overstressed part. So I thought maybe that, because a lot of times if the amygdala is not in balance, if it's not balanced, then it can create this
A
confusion
reason.
within the person.
That's correct. That could be a reason. It could
Mm,
be something else way out in left field.
mm,
Um, I'm just trying to think, like, what is like one of the strangest cases that I heard, and I'm almost drawing a blank right now, but it'll come to me.
yeah.
But I could definitely tell you that it's normally something that sounds like it's out in left field for the person, like something, like I said, the work is the stuff that the person is so
So
unaware
where,
of that it's hidden from them
and
completely.
they are so much in denial. If you even to brought it up, case in point, is interesting that we're talking about this today because earlier I had a client and I referred her to one of my colleagues who is a naturopath doctor. And the doctor said, it seems, and he's an intuitive as well. And he told her, you have, seems like you have some um, spirits within you that are invading and that needs to be released. And so she just told me that today. And I said, well, and she says, well, I don't believe in spirits. And I said, I said, you don't believe in spirits? She says, no, I don't believe in spirits. I said, so you're not Christian or believe that, that there are good spirits? And she said, well, yes, those are the only things, but not, there are no bad spirits or something in that effect. And so I just let her believe what she wanted to believe. But, it's interesting because they're in denial because number one, some of those adverse spirits don't want to come out.
Mhm.
They want to continue invade and enjoy that particular property. And it's an awakening, and this is why I share this information because people are so fearful, and fear is what blocks, is the biggest antagonist, right? Fear. And just to be able to learn that, there are entities in high and low places, and that if we come with an open mind and an open heart, we'll be able to heal a lot of the things that's happening to us. What
Mhm.
are your thoughts?
I believe that to a certain extent.
Mm-hmm.
Um, that does help, like being more positive, being more open, all of those things help to a certain extent. But I find people who are like extremely conscious,
Hmm.
they meditate, they eat really well, they take very good care of their bodies,
Hmm.
but they just have that one thing that they can't, like an itch they can't scratch for whatever
Yeah,
the is.
right,
And it, like I said, it may be something so totally out in left field.
right.
It's, I had a young lady who had a very serious disease, and I felt bad for telling her this.
Mm,
And what I was told to tell her after she told me about all her diagnosis, all these years of extensive treatments and all of this for a very, very serious disease. And her problem was that she was freezing all the time. We live, like I said, we living in Florida. This young woman would have on a coat,
hmm.
sometimes a scarf, a dicky,
Hmm.
um, then
I haven't
a,
heard that in years. I don't
yeah,
think people know what a dicky is. I haven't heard
it's
that
like
in
a
so
fake turtleneck,
many years.
a fake turtleneck, right?
It's a
Um,
turtleneck, but it kind of just goes up to here.
yeah, it just
So it
goes here,
covers an
it covers
open
your
neck.
neck.
I haven't heard that in
Exactly.
years. Oh my
So she
gosh.
would have on sometimes a sweater, sometimes a vest.
Yeah.
Uh, and we're in Florida, it's hot, it's like
Yeah.
78 degrees all the time, but
Yeah.
she was dressed like this. And after she told me about this long history, and her mom was an acupuncturist, so her mom gave her herbs and different things and healed a lot of the problems that she had, except for the freezing cold.
Yeah.
And with all of that, I was told to just say to her, just imagine the sun growing in your belly.
Mm. Hmm.
And after I said it, I said, Akiyaa, that's the darn stupidest thing you've ever told anybody. This lady have a really serious problem, and you're telling her to imagine the sun growing in her belly. Saw her about a couple of months later. She was in a tank top and a pair of shorts.
Yeah. Yeah.
And I said, wow, you don't have on your winter coat no more. And she's like, yeah, she said, I did what you said. Imagine the sun growing in my belly. And I got warmer.
Yeah.
So a few years after that, one of my students had written this paper, because at the end of semester, I'd always have them do some research and write a paper for me. And one of the students had written a paper, and in the paper it said that there was a Taoist monk. He was freezing cold all the time. He was taking all these hot herbs like aconite and ginger and cinnamon. He was, doing what they call moxibustion, heat therapy. He
Yes.
was doing
Yes.
all this
Yes.
stuff, and he was freezing.
Mm.
And then he came across a treatise, an ancient Qigong treatise, where they describe having the sun growing in your belly. And I was
Done.
reading it, I was like, oh my God, this is an actual thing. But
What
that's
do
what
they
I
call it?
mean.
They call it the Dantian in the
Dantian,
yeah,
right? And
right.
they gather the heat there. But I didn't have any concept of Qigong, the Dantian.
Yeah,
I didn't know any of this stuff. What the information I got to tell her was, imagine the sun growing in your belly.
yeah. And
And that was
it's
all, and she
yeah,
never had the problem with being cold again.
it's
And
a
that's the
wonder,
same thing with
yeah, it's
getting
a excuse me, sorry. It's a wonderful story on the power of imagination, the power of suggestion. And what I
Mhm.
was referring to earlier was not so much that having an when I was referring to an open mind and an open heart, it was in reference to being able to seek out other modalities for healing.
I
And
agree.
rather than saying, oh no, that's not, that can't be
Awesome.
it. A
You're
lot of
exactly.
times our limited beliefs, our religions stop us from opening up to thinking about the
It blocks the
possibilities
door.
that they are. So that's what I was in reference to,
I'm
because
glad that you class, because I meet people that they're positive thinking all day long, or
yeah,
they eat, and that doesn't,
no,
because there is something else also
yeah,
stopping them. My
stopping
question
them
is
too. Yeah.
always, what's stopping you?
And a lot
So
of
that's
people are using affirmations in vain and don't know how to use the
yes.
affirmation with this all their senses and to really to bring it into fruition. They think, oh, just putting it on a sticky paper or saying it or reading on their phone every day.
Yeah.
You're not reading it with intense and reading it and knowing it with intense emotion, then
Mhm.
it doesn't it's just in vain and it doesn't work for you, because and also how you phrase your affirmation also has a lot to do with whatever you want comes, because I do believe that anything that you ask the universe, you do receive. However, are you prepared to receive it? You may think you're not getting it. You're not getting it because you haven't prepared. Once you're in preparation for it, it comes.
Mhm.
And so this is fantastic, Dr. A. I did not know all of this about you. You got some
Yeah.
secrets going on here. So with the medical intuitive, that was a fantastic story. Do you still use that in your creation system?
In the creation system, the foundation of it is intuitive work
Mhm,
because one of like creation is in two phases.
mhm.
The first phase is that you have to clear up whatever is stopping the person.
Yes.
That's the first phase. That's the
Okay.
easiest and the fastest phase. And
Okay.
people don't really believe that that goes as quickly as it does. And my thing is like, since we're both therapists, you know what I mean.
Mm,
Is sometimes you're just doing the wrong treatment. That's all it is.
yeah.
You know, the person is not progressing, they're not getting any better. Maybe conventional wisdom is
Mhm.
telling you that this is the appropriate treatment or the standard of care for this
Yeah.
particular disorder. But
Yeah.
if the person's not responding to it, then that's not the right treatment.
Absolutely. Yeah.
So most people, instead of saying, hey, you know, I've done this for a minute and nothing is working, let me try something else.
Yeah.
Most people say, well, let's just go harder with it.
Yeah. Yeah. Or
That's
double the medication, right?
Let's double up. Let's go a little bit harder. Let's
Yeah.
do
Yeah.
more affirmations. Let's, you
Yeah.
know, get
Yeah.
more positive. You know, like most people think because maybe that's all the tools that they're given.
Yeah. Yeah.
My thing is to
Yeah.
just be very open and seeing actually what is it. I
Yeah.
don't go in there with any particular judgment or agenda. I'm just like a totally blank open book. Let's see what's happening.
Happening.
That's
Yeah.
why I said I hear some of the strangest things when I'm working with people
Yeah.
because it's, you know, it's like, wow, I've never heard of that before. Like the sun growing in your belly thing. I've never heard of that before.
Yeah.
But I just go with it. I'm like, well, this is what I'm being told. And my job is just to be the messenger,
Absolutely.
tell
Yeah.
you what you need to hear and tell you that ethically and truthfully.
Yeah.
That's my job.
Yeah. Thank you for sharing
So,
that. Yeah, we work similar because my company, Three Hearts One Beat, is made out of the understanding that we got to know what's going on physically with your body. We have to know what's going on emotionally with your body, and that it is the spiritual work that is the vehicle that helps it. And the spiritual work is whether or not you're doing breathing or exercising or tapping or whatever modality we choose, that is the actual work. And I agree with you. This is why I like to study different modalities myself, because
yeah,
one thing does not work for
one size does
everyone.
not fit all. Yeah,
That's
and they
right.
try to put everybody into this box where one size fits all, and it
Yeah.
doesn't. And that's the that causes a delay in healing.
Healing,
So find
absolutely.
out exactly what it is. The healing part or the getting rid of the block or whatever it is happens very quickly.
Yeah.
Because if you think if you pull a thread and begin to unravel a garment, all you have to do is find the right thread
Yeah.
and the whole thing unravels.
Yeah.
So that part is the easy part. The reason it's actually called creation, because the focus is really about what you're here to create and
Create. Yeah.
what you create, what it
Yeah.
is that you came to this life to
I
do.
get it. Yeah.
So that's the reason it's called. So it's like there's clearing and then there's creation. So the clearing is quick because we can
Yeah.
find out specifically what it is and get rid of that part.
Mhm.
The creating is the hard part because now maybe the person haven't done it. They're wrestling with their inner conflict of whether they're good enough, or they deserve it, or whether they can or not, or they have the aptitude or the ability for that. They're wrestling with rejection. Well, how would people think of me if I show up as my true self?
Mhm.
So the creation part is where the real work comes in because
Yeah.
it's open people to really create themselves as
Yeah.
who they really are so they could create whatever it is that they came here to
Yeah.
create. That's what the work is really about. And that's the roll up your sleeve and
Yeah.
get busy part of the work because that's the
Yeah.
part that really takes a while.
Seems as though it's a wrestle with the ego,
Mhm.
you
There
know,
is some hustle
ego
going
where
on.
where you're worrying about what other people say, and you're, and you're judging that versus having the other part of the ego where it is building you up and making you more confident within yourself. So
Yeah.
as you're describing it, I'm feeling as though it's a battle with your ego, outer ego and inner ego.
Outer.
I
Yeah, your
love it. I
awareness of
love
who
it.
you are. And so that's, like I said, that's the part. And so what I found is that what my ultimate goal is to create a community of people where we could clear up the patterns. Like I said, within 2, 3 months, the patterns are cleared up.
Mhm.
Now it's for you to accept yourself. That's the
Yes.
biggest part, is that
Yeah.
self-acceptance, to
Yeah,
accept yourself.
absolutely.
Most people don't like to see themselves as anything great. Most people will belittle themselves, they're their worst critics. And this is the thing that I find, is to convince people that no, you actually can. I mean, people argue with me. They know what, because normally your purpose is the thing you love the most. It's like built in. You could do that naturally, like breathing. A
Yes,
lot
right.
of times it's that's people's purpose. And they won't do that because, one, they think, oh, it's too easy. It's not hard work and struggle. So
Mhm.
there's no value attached to it because
Yeah.
I don't have to work hard and struggle. And anybody could do it. If it comes this easy to me, that means anybody could do it. So there's no value. And so how could I possibly make a living doing my purpose or fulfilling that part of my life? So you have that kind of conversation going on with them. The other thing is, like, who am I? Who am I to think I'm great? I don't have all these credentials and whatnot. Like, I had one woman, I had to wrestle with her. I said to her, "You're a master healer." You
Mhm.
know what she told me? She said, "I thought you were just being nice to me. I thought you were just telling me a lot of stuff you thought I wanted to hear." I'm like, "No, I'm not that nice." I'm nice, but I'm not
Not
that
that
nice.
nice. Yeah,
I
it has
don't go
been,
around telling people, stuff they want to hear. Sometimes I have
yeah,
to tell people stuff they don't want to hear,
the deep
so I don't have any
programming.
problem.
Yeah.
Yeah, I don't have any problems doing that either. So, and then I had to convince her, and she was like, "Well, I don't have a degree. I don't have this credential. I don't have this. And so she was judging herself, and how could poor little old humble me be this great healer? And and it took a few months to get her to accept that part of herself. And now she does phenomenal work. She's fully booked. I mean, her practice is thriving. And
Wow.
people come to her, they're like, she's an amazing healer.
Look at that.
But it took her a minute to even accept that about herself.
And that's the type of work that you do um, in your creation system. Uh,
Mhm.
and so if people were to come to you, what other type of things would you be working? And how does this system work? Is it that you're going to be using acupuncture or your medical intuitiveness? Or is it that you're going to be basically helping the individual unblock the unconscious to challenge the unconscious uh, blockages?
Yeah,
What,
all of the above.
all of the above. This
Because
is great.
when someone comes to see me,
Hmm.
I I listen.
Hmm.
The session takes a minute because the biggest part is me listening, because they have to get it off their chest.
Right,
This is what's in their heart, get it
right,
off their chest. And normally people don't have people that listen to them.
right.
Yeah, like nobody wants to listen to someone else. So
Yeah,
I give them that space of just listening, and I listen really deeply and keenly to
yeah,
everything they have to say, before I actually get into the work. And I always ask, what's going to be the best modality for this person?
yeah.
Sometimes it's acupuncture, sometimes it's creation, sometimes it could be body talk, it could be a lot of different things that they need. It could be balance their chakra, it could be a lot of different things. So I always ask and honor the wisdom that the person have in their body, their higher self.
That's right.
Okay, I listen off which will be the best thing for me to do for this person. And then I go that way. So sometimes it might be just one thing I do. Sometimes it could be 3, 4 different modalities that I do that combine together for that person. So it could be anything, but I always just ask. And before I do anything, I ask first, like,
Always
what's
that,
best?
and asking permission for the body if you can start the work. You know,
Exactly. And
giving
I
us.
might not be your therapist.
That's
Exactly
right.
like what you
That's
said. I
right.
might get like, oh, you're not supposed to see me. You need to go see Dr. Sharon because you got something going on with your heart. And she's the heart lady. She knows how to deal with that or
With
something
those
going
deep
on in your
emotions,
relation.
yes. Well, thank you.
Exactly.
Yeah, thank you for sharing, Dr. Akiyaa Azula. This has been really eye-opening. Heartbeaters. I mean, it wasn't that a wealth of information. I know you got to go back and replay this because she dropped some gems. Yes, she did. Dr. Akiyaa, tell us, how can we get in touch with you? Are you, I know that you just moved here. Are you in practice? Are you going to have a course? What other goodies do you have out there that we can nibble on? And
Okay.
I'm hoping that people, that our heartbeats out there, our viewers and our listeners are taking this in and understanding the deeper part of what she's saying, that many of us don't realize that there are things that are blocking us from moving forward or blocking our healing. And so it takes masterful healers such as Dr. Akiyaa to help you work through that so that you can find the joy, the love, the abundance, and be able to manifest and do all the things that you want to do. This is another modality that I'd love for you all to take interest in. So, Dr. A, how can folks get in touch with you?
Right now they could reach me as you see on the screen. I
Yes,
got at Zula Creation. That's my Instagram handle, so they could reach out to me there.
perfect.
It's the same Azula Creation on Facebook, so they could always drop me a DM
Yes,
or a PM and reach out to me that way.
okay.
Right now, I don't have anything as far as workshops and classes set up.
But
I
we will. We're going to be doing some
we
work
will be
together.
having
We will.
we'll be having some of them set up. One of the things that I've been working with, because like I said, I got up and I had the meditation and I heard you'll be teaching creation. You need to do creation with people. I also got up one morning and I got the 17 ways you F up your money and how to fix it. So I will be doing an online class, and this more so has to do with people with the relationship that they have to money, the reason why people struggle with money. Because
Mm,
at the end of it, money is just a math equation. It's addition and subtraction.
right.
Spend less than you have is math.
Yeah.
And even though it's simple math, it's third grade math, basically,
Mm,
have such a struggle with something that basic and that
yeah.
straightforward.
Yeah.
So finding out all the ways that people have these issues around money is the course that I'm working on. I
Okay.
haven't put anything together because I've been busy with the Georgia licensing,
Mhm.
but I will be putting that together to help people with their money issues. And so it's using a combination of creation along with a lot of the other tricks I got up my sleeve.
All right. Well, I am ready.
Oh,
I
sure.
hope you heartbeats are ready too. And as we end, I always ask my guests to talk about the heart. So, what do you do for your physical heart? How do
For
you
my
keep that healthy? Yes, your
Okay,
physical.
for my physical heart, it is nutrition. I do a lot of breathing and stretching like yoga. I
Mhm.
used to walk a lot, but since it's been cold and I've been working, been busy in the mornings, I really like morning walks. So I have to get back on that. So as far as the physical heart, I would say movement, breathing, and nutrition are the
Beautiful.
things that I do. And I am a vegan, so being plant-based.
Yeah.
I used to have like a lot of sinus congestion, and
Mhm.
I found out that I actually have a dairy allergy my entire
Mm.
life, like clogged ears, the whole 9 yards.
Mm.
And then I just, for some reason, came across the information and I was like, oh, I'm not lactose intolerant, but I have a dairy allergy. And once I got rid of the dairy in my diet, all of that cleared up.
Cleared up.
Mhm.
Beautiful. And so what do you do for your emotions? How do you is there a particular modality for when you're emotionally stressed, and what do you do to kind of protect your heart from deep emotional wounds?
Okay. Um, be honest with myself that it's
Mm,
going on because you know, I'm, I'm from the generation of suck it up and keep going.
mm,
So
yeah.
you don't really get, and then being from the Caribbean,
Yeah.
you don't really get a lot of emotional heart and all of that, because that's part of the culture also is like you got to be tough.
Yes.
So I found that I would compartmentalize a
Mm,
lot. Like I got stuff to do, I got work to do, I don't have time for this or that.
yeah.
So I found that since I've been here in Atlanta, I've been healing my heart a lot more. A lot of things that I've held on to, a lot of sorrow, a lot of grief, a lot of
Yeah.
pain, that it's like I don't have time for that. I've got work to do,
Hmm.
energy. I've been sitting with it a lot more. I've been processing that stuff a lot more. Um, and just becoming really aware that it's there,
Yeah.
and then finding out, well, what do I need to do? Same thing I do with my patients. Okay, now what do I need to
Do
do? Do I
there
need
you
to do
go.
some
That's
acupuncture,
right.
or do I need to call one of my mentees and have them do a creation
Yeah.
session for me? Do I need, whatever it is? Do I need to go for a walk? Whatever it is, I
Yeah.
just find out,
Find out.
okay, this
Yeah.
is what you need to heal.
Mm.
Or sometimes just recognizing it and facing it and dealing with it and realizing that I've been holding on to it and it's okay to let go of it.
Mm. And
So
so that's good. More gems. Thank you for that. Us as coaches and healers and teachers, I think what makes us good is when we follow our own advice and even know when we need to go to someone else to help
yes,
us to
exactly,
heal. Yeah. What
exactly.
what type of things do you do to enrich your spirituality?
That one I would definitely say is a work in progress for me. Most people would classify me as extremely spiritual
Hmm.
because of my intuitive ability and those gifts. So
Hmm.
most people kind of classify it that way.
Hmm.
Um, but the more I work, the more bigger and vast I see spirituality is. Like we
Yes.
try to pigeonhole it into this very narrow,
Yes.
you know, um, there's a difference between religion and spirituality.
Spirituality.
Religion is like
Absolutely. Yeah.
dogmas and doctrines and,
Yeah.
a way of, you fit into a culture, or
Yes.
they say it's a
Yes.
cult, but it's a culture. There's a culture to it. Where spirituality is really yourself, getting to know the vastness of who you really are.
Absolutely.
So the spiritual heart is really a work in progress. Like I said, this since I've been here in Atlanta, it's given me more time because I haven't been seeing patients the way I used to see patients.
Hmm.
I haven't been teaching and doing workshops and seeing students, so it's given me more me time and it's
Yeah.
given me time to heal. And also, like I was talking about the patients that I have,
Yeah.
in order for me to really be of benefit to the people that I'm here to help and lead,
Yeah.
I need to be in a position myself where I'm also whole.
Yeah.
So that's why I said it's more of a work in progress.
Yeah.
It keeps happening. I keep getting more insights and more knowledge as time goes on.
Yes.
So it's like the new frontier, my
Yes.
spiritual.
All right. I think that that was a perfect answer because spirituality is a evolution. You continually to grow. So there is no, I'm perfect now. It's always growth. And I think
Yes,
that is the definition of spirituality. It's always going to the next level, into the next level, into the next level, into the next dimension, into the next dimension, because we are multifaceted individuals. It's been an absolute pleasure speaking with you. I do apologize. I am not at my office, so there was some background noise, and the lighting is that not that perfect, but we can see and hear you very well. So
thank you.
I will be sending out this footage as is because I believe in being as unique, as authentic as
Yes,
possible. So I really, really thank you for sharing, taking this time to share with me
my
and
pleasure.
viewers and listeners. And we will look forward to more of your works, Dr. Akiyaa Azula with
I appreciate it.
Kia I'm sorry, with Azula Creations. Is that right?
Thank you.
Yes.
Thank you.
All right. One love, everyone. If you have any other questions, just ask the Heart Lady. I got you.